Tracey Cole is from the Cheshire Clinical Commissioning Group, which looks after health services in the county. She's on with us this morning. Morning, Tracey.
Good morning.
Tell me how things are going for you.
It's good to speak to you, John. Things are going really well. It's a massive effort for everybody in the NHS and all partners to roll out this largest vaccination programme in British history, but I think we should be very proud of the way it's going so far.
What are the most difficult things about it?
It's speed. We now need to vaccinate the vast majority of our population. So the government have committed that anybody over the age of 16 will have this vaccination by the autumn. So supply of the vaccination initially was an issue because obviously they've only just been approved. But now it's about setting up vaccination centres, as many as possible across the UK. So the challenge is about speed and supply to make sure we reach as many of the population as fast as possible. But that's happening, and it's happening in all areas across the UK.
Where are the ones around here in Cheshire East where you can go and get a jab?
So there's a range of places. So you'll have heard about the 7 mass vaccination sites, so Birmingham and Manchester, and people may be invited to those and can choose to travel if they wish to do, or they can go locally. So there are some pharmacies. So we've got a pharmacy in Alsager, a pharmacy in Macclesfield. We have hospital hubs, so all the hospitals across Cheshire and Stafford in particular have centres. And GPs have come together in groups, so it might not be your local GP practice, but they've grouped together. So there are some in Wilmslow, Congleton, Knutsford, Nantwich. We've got them in coming live in all sorts of different places, and we can send you a full list and help you put that on your website if you want to. So Poynton, Middlewich, you name it, they're going live as we speak and in the coming days so that they're local to our population.
Fab. You know the list that you're kind of working through. How does that work in each GP surgery? Do they literally just go on date of births and whether people have got maybe underlying breathing or lung problems? How does that work?
Yeah, it's a really good question. So everything we're doing is set out by the government. So we're following the national guidelines, and that's then decided by a committee. So we've been asked to make sure that we focus initially on residents in a care home and their carers, and anyone who's over 80 years old or a frontline health and care worker. So to answer your question, they will work through the list of their population and check who fits within those categories, and then those are the people who will be invited. But there are different numbers of people in different areas, and some areas have more people aged 80 and over. So some people will be called in and have been already, as I heard your listener earlier reporting, and some will receive their letter or receive contact from the NHS in the coming days and weeks. So we ask you to be patient, and I know that's very difficult, but the NHS will contact you when it's your turn.
What will you do? You get a text or something, do you? What happens?
It varies. So some it depends which of those sites you are invited to. So some places some people will get a letter. Some people have been called by their practice, and also we're starting to use text messages as well. So there's a variety of methods, and we're also putting in place support from other partners where we'll try and contact those that are hard to reach, or don't often use email or are not on the phone. So we're using all different methods to make sure that we contact people.
Okay, this Oxford vaccine, I saw some headlines yesterday about care homes and only 1 in 10 people in care homes have been vaccinated. I think a lot of that has been to do with the difference in how to store the 2 vaccines that we've had so far. Now that we've got this Oxford AstraZeneca vaccine, does it mean that it's easier for you to start doing care homes en masse?
It does, you're absolutely right. So we're very lucky that we've got 3 authorised vaccines. That's more than any country in the world. And at the moment, the Pfizer vaccine and the Oxford AstraZeneca vaccine are the ones that are being used at the moment. And you're right, the AstraZeneca vaccine is much more easy to transport and make sure that it's easy to make sure that we can use that in care homes. So we have been asked to make sure that the work, and it's particularly being led by GPs and primary care care, that they're going into the care homes and making sure that they're vaccinating all the residents in the care home and the staff in those care homes. So that's happening now and today and in the coming weeks, to get those done as fast as possible, because they're at the top of that list of priorities.
I've seen all over the papers that they're kind of hoping for volunteers from different organisations, and loads have been recruited. Is that something that you need? Do you need people to help out? What's the deal? Have you got enough people?
We do need people. So again, after this, I'll make sure that we send you the details as to how people can get in touch if they want to be involved. We have had a massive response to people who've contacted us already. So we've got some people who are returning to practice, perhaps a retired doctor or a range of other people who've said, I want to be part of this and I would be willing to be trained up to give the vaccination. But we do need car park attendants, and we also need other people that perhaps aren't going to be involved in contact with patients, but that can just help the centres run effectively. So we would be grateful for those helpers, and it's really great that people want to come forward to do that. So yeah, I'll give you those details. What we have at the moment said we've got plenty of our sites. So we've had lots of offers of people saying, would you like to use our village hall or a range of other things. At the moment, we're not asking for any more sites to be put forward. If we need them, we'll start to contact people. But it was just to let you know that that's something that we've got plenty of at the moment. So yes, volunteers would be really useful. Thank you.
Tracey, good to chat to you this morning. Thanks for coming on.
Thank you for having me.